This is Dr. Farahani from Instant Pet Hospital and Emergency. Today we're going to talk about the risk associated with fire exposure or any smoke inhalation in your pet. First of all, the risk would be either toxic gases or any thermal or heat exposure or fire exposure that would cause burns. Toxic gases, the first one would be carbon monoxide that develops with incomplete burn of wood or any material. And the second one is a hydrogen cyanide that is released after burning of any plastic product, nylon, silk, or anything as such. So these two gases, they can compete with oxygen in blood, and they can prevent the blood from carrying enough amount of oxygen for your pet. Thermal burns will be immediate burn, which would be burning of the surface of the body. Any close exposure to the fire inhalation can also burn the internal lungs and the trachea, basically. So in case of any of the unfortunate events, the signs to look for, the main sign to look for is any signs of abnormal breathing. Abnormal breathing will be basically extension of the neck, abdominal contraction when they're breathing. So if you see your pet like extending their neck, breathing heavily with like abdominal movement, so those would be emergency signs that you would have to bring your pet to a veterinarian. In those cases, we basically will start with starting some oxygen for your pet. We will measure the amount of oxygenation in the blood, and also we will measure the EKG, which is the heart rhythm that we will see on the machine. So any of those abnormalities we can address with different medications. Oxygen is one of the main things. So if your pet is exposed to fire or smoke, being in a well oxygenated environment will be the first thing to do. Sometimes they need a higher concentration of the oxygen that could be provided at a hospital. So as far as the aftercare, we talked about the oxygen supply to the body, the lung functioning, and also the heart functioning. The third thing is the actual burn on the skin or the surface of the body. So any burn on the surface of the body needs to be addressed at your veterinary office. If the amount of or the surface of the burn is more than 20% of the body, then the body will be at risk of developing shock. So if you see burns on the body that is more than 20% of the surface of the body, then that will be an immediate emergency. Anything less than that definitely is indicated to bring your pet to the veterinary office, but it's not as much of an emergency, basically. As far as the treatment,